We used two of the most advanced AI models to create two characters. We will put them face to face. Their arguments will be evaluated by 5 independent AI models across multiple criteria, scored from 0 to 100. This is AI Debates. Does banning abortion protect or endanger women's health?
Banning abortion protects women's health by affirming that both mother and child deserve care, not that one must be destroyed for the other to live. Abortion itself carries physical and psychological risks. Complications, such as infection, hemorrhage, and emotional trauma, are real and often minimized. A ban, paired with strong support systems, encourages life-affirming alternatives like adoption and provides opportunities for better maternal health care and social support. Critics argue it endangers women by limiting options in medical emergencies, but well-written pro-life laws allow necessary interventions when the mother's life is truly at risk. The goal is never to sacrifice women, but to protect both patients whenever possible. True healthcare seeks to heal and preserve life, not intentionally end it. Thus, banning abortion, while ensuring robust support and clear medical protections, safeguards women's well-being while also protecting their children.
Banning abortion endangers women's health. The evidence is overwhelming and tragic. Maternal mortality has increased in restrictive states. Women are dying from sepsis, hemorrhaging, and pregnancy complications because doctors fear prosecution for providing standard care. Emergency rooms delay treatment while consulting lawyers instead of saving lives. Delayed care for miscarriages and ectopic pregnancies, life-threatening conditions requiring immediate treatment, has become common as providers navigate confusing legal restrictions. Women have been sent home to bleed while fetal heartbeat requirements override medical judgment. Mental health deteriorates when people are forced to carry unwanted pregnancies, with increased rates of depression, anxiety, and domestic violence. Unsafe abortions increase when legal ones aren't available. History and global data show bans don't eliminate abortions, they make them dangerous. Preventive care suffers as reproductive health providers close, reducing access to contraception, cancer screenings, and routine gynecological care. Medical organizations worldwide oppose abortion bans precisely because they harm women's health. Evidence-based medicine requires trusting doctors, not politicians, with healthcare decisions.
Would abortion bans increase unsafe, illegal procedures?
History and data suggest that abortion bans do not inevitably lead to widespread unsafe, illegal procedures. Before Roe v. Wade, many abortions were already performed by physicians, not in dangerous back alleys. Today, with modern healthcare, women have far greater access to prenatal care, emergency medicine, and resources than decades ago. In countries where abortion is restricted but maternal care is strong, women's health outcomes remain good. Moreover, the law serves as a teacher. When abortion is restricted, many women choose life rather than seeking illegal procedures, especially when society offers support for mothers and families. The better solution is not to permit abortion for fear of illegality, but to build a culture that makes abortion unthinkable by providing compassion, resources, and alternatives. Just as we don't legalize theft to avoid black market crime, we shouldn't legalize abortion because some might break the law. We should instead work to protect life and support women.
Yes, abortion bans dramatically increase unsafe, illegal procedures. This is documented historically and globally. Pre-Roe America saw thousands of women die from back alley abortions, septic procedures, and dangerous self-induced attempts. Hospital septic abortion wards were filled with women suffering complications from illegal procedures. Global evidence is clear. Countries with restrictive laws have similar abortion rates to those with legal access, but far higher rates of complications and death. The WHO documents that abortion bans don't reduce abortions, they make them deadly. Current data shows people are already ordering abortion pills online, attempting dangerous home remedies, or traveling to unsafe providers. Digital surveillance of pregnancy outcomes is increasing as authorities investigate suspected illegal abortions. Economic disparities worsen the problem. Wealthy women can travel for safe procedures, while poor women resort to dangerous alternatives. Bans don't eliminate demand, they eliminate safety. Women have sought to control reproduction throughout history regardless of legality. The choice isn't between abortion and no abortion, it's between safe, legal procedures and dangerous, illegal ones.
Is abortion ever medically necessary to save the mother's life?
Direct abortion, the intentional ending of an unborn child's life, is never medically necessary to save the mother. Modern medicine can treat life-threatening conditions such as ectopic pregnancy, severe preeclampsia, or infections by addressing the mother's health while seeking, whenever possible, to preserve the child's life. In rare cases, a medical intervention may unintentionally result in the child's death as a side effect, but that is ethically different from deliberately killing the child. For example, removing an ectopic pregnancy treats a dangerous condition threatening the mother. The baby cannot survive regardless. Pro-life laws typically allow such interventions under the principle of double effect, where the goal is to save the mother, not to end the baby's life. Thus, while urgent medical care is sometimes required, intentionally aborting the child is not the solution. True healthcare protects both patients to the greatest extent possible.
Absolutely, abortion is sometimes medically necessary to save women's lives, and restrictive laws are already preventing this life-saving care. Ectopic pregnancies are never viable and will kill the mother without prompt treatment. Severe preeclampsia, HELP syndrome, and placental abruption can rapidly become fatal. Septic miscarriages require immediate intervention. Cancer treatment during pregnancy may require termination to save the mother's life. Current restrictions are creating deadly delays. Doctors in restrictive states report waiting for women to become sick enough to justify intervention legally, rather than providing optimal medical care. Women have been airlifted to other states while bleeding out because local hospitals feared prosecution. The maternal mortality rate has increased in restrictive states, with preventable deaths from pregnancy complications that could have been treated earlier. Medical organizations emphasize that these decisions require split-second judgment based on rapidly changing conditions. Legal restrictions interfere with time-sensitive medical care, forcing doctors to prioritize legal compliance over patient survival. When politicians override medical expertise in life-threatening situations, women die unnecessarily.
Does access to abortion improve public health overall?
No, access to abortion does not improve public health overall, because public health should be measured by how well we protect and sustain human life, not by how efficiently we eliminate it. Abortion ends the lives of hundreds of thousands of unborn children each year, which is itself a public health tragedy. While some claim it reduces maternal mortality or poverty, those issues are better addressed by improving prenatal care, expanding healthcare access, and supporting families, not by destroying life. Studies also show abortion can have negative physical and psychological effects on women, including increased risk of depression and complications in future pregnancies. True public health solutions strengthen both mothers and children, offering resources, medical care, and community support. A society that equates health with access to abortion overlooks the dignity of the most vulnerable and misses the chance to promote life-affirming alternatives that benefit everyone.
Yes, abortion access significantly improves public health across multiple measurable outcomes. Maternal mortality decreases when women can access safe, legal procedures and comprehensive reproductive health care. Countries and states with abortion access have lower maternal death rates. Family planning improves when people can time pregnancies appropriately, leading to healthier spacing between births, reduced high-risk pregnancies, and better prenatal care for wanted pregnancies. Economic health benefits include reduced poverty rates, increased educational attainment, and better child welfare outcomes when families can plan their size and timing. Healthcare infrastructure strengthens when reproductive health providers can offer comprehensive services including contraception, STI testing, cancer screenings, and prenatal care, services that benefit entire communities. Population health improves when unwanted pregnancies are reduced through comprehensive reproductive health care, leading to better outcomes for existing children and families. Mental health benefits when people aren't forced into unwanted pregnancies, reducing depression, anxiety, and domestic violence rates. Public health data consistently shows that societies with comprehensive reproductive health care have better overall health outcomes across all demographics.
Should abortion be considered part of essential health care?
No, abortion should not be considered part of essential health care, because healthcare's purpose is to heal, preserve, and protect life, not to intentionally end it. Labeling abortion as essential redefines medicine in a way that undermines its most basic ethical foundation. First, do no harm. The unborn child is a distinct human being, and ending that life is not a medical treatment, but the destruction of a patient. Essential healthcare includes prenatal care, safe delivery, maternal support, and interventions in emergencies where both mother and child are treated with dignity. Framing abortion as essential sidesteps real solutions, better healthcare access, financial assistance, adoption support, and policies that empower women to thrive without sacrificing their child. True essential healthcare uplifts both mother and child, ensuring that medicine remains focused on preserving life rather than terminating it. Yes, abortion should absolutely be considered essential healthcare. Major medical organizations worldwide recognize it as such. Medical consensus is clear. The WHO, American College of Obstetricians and Gynecologists, American Medical Association, and virtually every major medical body classify abortion as essential health care. It's often time-sensitive and medically necessary. Emergency situations require immediate access, ectopic pregnancies, severe fetal abnormalities incompatible with life, maternal health crises. Delays can be fatal or cause permanent damage. Reproductive health care integration means abortion is part of comprehensive women's health services alongside contraception, prenatal care, and miscarriage management. Separating it creates artificial barriers that harm patient care. Healthcare equity requires consistent access. When abortion is treated as elective rather than essential, insurance coverage gaps and facility restrictions create unequal access based on wealth and geography. Evidence-based medicine supports abortion as safe, common health care. It's safer than childbirth and many routine procedures we consider standard care. Treating abortion as non-essential health care contradicts medical evidence and professional standards, politicizing what should be clinical decision-making.